Welcome to the Office of Group Benefits Plan Year 2021 Annual Enrollment Presentation for Active Employees. Effective January 1st, 2021, premium rates for the Blue Cross Blue Shield plans will increase by 5.5%. Premium rates for the Vantage Medical Home HMO plan will increase by 6%. Remember, members enrolled in the HSA must elect or re-elect their HSA contributions for the 2021 plan year. Members enrolled in the FSA must re-elect or elect to participate in the 2021 plan year. Remember, if you would like to remain in your current OGB health plan with the same covered dependents, no action is necessary during the annual enrollment period. Annual enrollment begins on October 1st and will run through November 15th. Your new plan year will begin on January 1st, 2021. During annual enrollment, you may enroll in a new health plan, drop or add dependents, determine the amount of your health savings contribution, enroll, renew, or change your contribution to your flexible spending arrangement, apply for life insurance plan, or discontinue your OGB coverage. Whether you are considering retiring soon or further down the road, there are some things you need to keep in mind regarding your OGB health plan. First, your coverage must be in effect immediately prior to your retirement to be eligible for retiree coverage. If you started participation or rejoined state service on or after January 1st, 2002, the state contribution to your premium is based on the number of participation years in an OGB health plan, not the number of years you have worked for the state. This participation schedule shows the number of years a member must participate in an OGB health plan to receive a specified state contribution. This participation schedule also applies to the LSU First Health Plan. Now let's take a look at the health options available to OGB members. Active employees can select from 5 benefit options through Blue Cross and Blue Shield. Those are the Pelican HRA 1000, the Pelican HSA 775, Magnolia Local Plus, Magnolia Open Access, and Magnolia Local. Active employees also have the option of selecting the Vantage Medical Home HMO plan. Here are a few videos that will go over each option.
The Pelican plans are consumer-driven health plans. They have lower premiums but higher out-of-pocket costs throughout the year. They are good for members who want more control over their healthcare spending. Pelican HRA 1000 uses Blue Cross's large statewide preferred care provider directory. Members also have access to Blue Cross and Blue Shield Association national providers. Out-of-network coverage is also provided. Active employees, retirees without Medicare, and retirees with Medicare are all eligible for this plan. Pelican HRA 1000 offers a low premium combined with a health reimbursement arrangement, or HRA. OGB puts a set amount of money each year into your HRA. You use your HRA to pay for covered medical expenses until the fund is used up. As long as claims are submitted properly to OGB, OGB will pay claims directly from your HRA to providers. You will not have to do anything. Your HRA can be a good way to save money for future health care, since unused HRA funds roll over to the next year, as long as you remain enrolled in the Pelican HRA 1000 plan. If you leave your employer or switch plans, money in the fund returns to OGB. Pelican HRA 1000 is a co-insurance plan with a deductible. You pay 20% of your healthcare costs for an in-network coverage, while OGB pays for the other 80%. You will pay 40% of costs for non-network providers, while the plan pays 60%, so it costs less to stay in your network. Pelican HRA 1000 has an out-of-pocket maximum. After you reach that number, 100% of your qualified care will be paid by the plan. Pelican HRA 1000 does not have separate deductibles and out-of-pocket maximums for members who retire before March 1, 2015. The Pelican HSA 775 plan is available only to active employees and their dependents. Retirees cannot choose Pelican HSA 775. This plan uses Blue Cross's large, statewide preferred provider directory. Members also have access to Blue Cross and Blue Shield Association national providers. Out-of-network coverage is also provided. Pelican HSA 775 offers a low premium in combination with a health savings account or HSA to which the member and employer contribute to create an affordable option for members. An HSA is a savings account that allows you to save money tax-free for medical and pharmacy expenses. You can use it to meet your deductible and out-of-pocket expenses and help save for future healthcare expenses. OGB will put a set amount of money into your HSA account at the beginning of the year, and you can add more money to the account. OGB will match any contributions you make through payroll deductions up to a certain amount, but you can contribute beyond that, up to federal limits. You can use your HSA for any qualifying expenses you see fit. You will receive a debit card, and you can submit claims to your HSA to be reimbursed. Any money left in your HSA will roll over to the next year, and you can take your HSA with you if you change plans or jobs. Pelican HSA 775 is a co-insurance plan with a deductible. You pay 20% of your healthcare cost for in-network coverage, while OGB pays for the other 80%. You will pay 40% of costs for non-network providers, while the plan pays 60%. So it costs less to stay in your network. Pelican HSA 775 has an out-of-pocket maximum. After you reach that amount, 100% of your qualified care will be paid by the plan. Pelican HSA 775 uses Blue Cross's Express Scripts prescription drug coverage. See your enrollment guide for details. Magnolia plans offer higher premiums in exchange for lower out-of-pocket costs throughout the year. Magnolia plans could be good for members who want the peace of mind of level costs throughout the year. Magnolia Local Plus uses Blue Cross's large statewide preferred care provider directory. You will also have access to Blue Cross and Blue Shield Association national providers. In the Magnolia Local Plus plan, out-of-network coverage is provided in emergencies only. You will have to pay 100% of other non-network services. Active employees and retirees with and without Medicare can sign up for Magnolia Local Plus. This plan uses co-payments and co-insurance. Many services are offered for a set co-payment, but some use co-insurance for which a low deductible applies. Magnolia Local Plus also has a low out-of-pocket maximum. After you pay this amount in co-payments and co-insurance, you will be covered at 100%. Please note that members who retired before March 1, 2015 have different deductibles and out-of-pocket maximums. Magnolia Open Access uses Blue Cross's large statewide preferred care provider directory. You will also have access to Blue Cross and Blue Shield Association national providers. Active employees and retirees with and without Medicare can sign up for Magnolia Open Access. Magnolia Open Access is primarily a co-insurance plan with a low deductible. If you are an active member or non-Medicare retiree, you will pay 10% of your in-network healthcare cost, and OGB will pay 90% after you reach your deductible. For non-network providers, you will pay 30%, and OGB will pay 70%. If you are a retiree with Medicare, you will pay 20% of your healthcare cost, and OGB will pay 80% after you reach your deductible for in- and out-of-network healthcare cost. There are a small number of copayments for facility charges, like emergency room visits and hospital stays. You will have to pay coinsurance and copayments until you reach your out-of-pocket maximum. Please note that members who retired before March 1, 2015 have different deductibles and out-of-pocket maximums. Additionally, eligible expenses for both network and non-network providers will count toward the out-of-pocket maximum for members who retired before March 1, 2015. Magnolia Open Access has an additional feature called Retiree 100, available to plan members who meet certain criteria. Members must be retirees, have Medicare as their primary insurance, and have very high medical costs. How does Retiree 100 work? Medicare and OGB normally pay a significant percentage of your eligible healthcare expenses. However, since Medicare pays only part of the cost and OGB benefits only apply on what is left after Medicare pays, you may have to pay part of the cost as well. But Retiree 100 coverage may have higher reimbursements for eligible medical expenses after you meet your deductible. Retiree 100 looks at the total charges from an eligible provider, not just the balance due after Medicare has paid. What is the advantage of the Retiree 100 program? Retiree 100 provides additional coverage for plan members who have extensive hospital bills and/or physician charges due to a serious illness, accident, or long-term chronic condition. The final Magnolia plan is our Select Network plan. This means that the networks are designed for people who live in specific parishes. Magnolia Local is a health plan for members who want local access, affordable premiums, and a new approach to healthcare. A select network doesn't mean less care. We've worked with major providers to create networks in your hometown that can care for all of your health needs. You will still have a full network of primary care doctors, specialists, and other healthcare providers in your area. Members who live in the greater Baton Rouge area use the Community Blue Network. Providers in this network include Baton Rouge General Medical Center, Baton Rouge Physicians Group, and the Baton Rouge Clinic. Members who live in the Lafayette, Greater New Orleans, Shreveport-Bossier, or St. Tammany regions use the Blue Connect network. Blue Connect includes some of the biggest providers in those regions. Magnolia Local is a perfect fit for some, but not others. Before you choose Magnolia Local, consider these questions. Which doctors' clinics do you go to the most? Which clinics, hospitals are closest to where you live? Are you prepared to stay in network? Staying in network is very important. As long as you receive care within your network, you will pay less than if you receive care outside of the network. Out-of-network care is covered only in emergencies. Active employees and retirees with and without Medicare can sign up for Magnolia Local. Magnolia Local uses copayments and coinsurance. Many services are offered for a set copayment, but some use coinsurance for which a low deductible applies. Magnolia Local also has a low out-of-pocket maximum. After you pay this amount in copayments and coinsurance, your care will be covered at 100%. Please note that members who retired before March 1, 2015 have different deductibles and out-of-pocket maximums.
Vantage Health Plan is excited to once again be offered as a health plan to Office of Group Benefits active and retired employees. If you're already a Vantage OGB member and would like to keep your medical home HMO plan, you don't have to do anything. You will remain enrolled with us unless you make a plan change through your agency or OGB. This plan is sponsored by OGB, and you don't lose any of your state benefits when you choose Vantage. Open enrollment for OGB active and retired members is October 1st through November 15th, and we would be pleased to have the opportunity to serve you. If you have questions after watching this video, please reach out to Vantage by calling 844-536-7104. Vantage's plans are available statewide in every parish and to all eligible state employees and retirees. Our provider network spans the entire state of Louisiana. Vantage has hospital contracts with Our Lady of the Lake Regional and Children's Hospitals, Women's Hospital in Baton Rouge, Lake Charles Memorial, Tulane Medical Center and Children's Hospital in New Orleans, and Rapides Regional Medical Center, to name a few. Our participating hospitals ensure great care and great coverage across the state. We also have several of the state's largest physician groups in network too, including Crescent City Physicians, Our Lady of the Lake Physicians, Affinity Health Group, Baton Rouge Clinic, Christus Health, LSU Health Systems, Lourdes Physician Group, and others. Vantage is affiliated with Affinity Health Network, which is a network of preferred providers across the state. These providers include primary care providers, specialists, outpatient services, and surgeries, and after-hour clinics. You can receive reduced copays from Affinity providers. In our plan documents, look for lower copays listed as AHN. To find in-network providers, visit www.vhp-stategroup.com, click the OGB Medical Home link, and then the Find a Doctor link. Follow the steps shown here to find our participating providers. Vantage's medical home HMO plan also includes out-of-network coverage. Emergency care is always covered at the in-network benefit, but if you need to use an out-of-network provider, call Vantage to get a prior authorization. For out-of-network authorized services, a member pays the out-of-network deductible, then 50% coinsurance. Vantage will pay up to $5,000 towards your out-of-network costs. Vantage makes your healthcare simple, both when you're healthy and if you get sick. Vantage members have low office visit copays that include most services performed at the office, including most lab work, tests, and screenings. For a more detailed list of the medical home HMO plan's deductible, copay, and coinsurance amounts, visit www.vhp-stategroup.com and click the OGB Medical Home HMO blue button. The Documents and Forms section includes the cost share schedule and certificate of coverage. In addition to covering your medical needs, Vantage also covers extra benefits like vision and dental coverage. There is no additional premium, as this vision and dental coverage is included as a part of our medical home HMO plan. Routine vision exams are covered annually at the specialist copay when you see a participating provider. For each member, Vantage will also pay up to $100 annually for your glasses or contacts. To keep your mouth healthy, Vantage also covers dental services included as a part of the medical home HMO plan. Routine preventative dental exams and cleanings are covered at 100% twice per year. For fillings, crowns, and other basic and major dental services, Vantage will also pay up to $500 annually for each member. Vantage's pharmacy benefit covers a broad range of prescription drugs. We use a 6-tier formulary, which is a list of covered prescription drugs. On our Medical Home HMO webpage, click the Documents and Forms link and then use the formulary to see if your drug is listed and its tier. Your only cost share for prescription drugs is a copay. Our plan has no deductible or co-insurance for prescription drugs. If you take maintenance medications, consider our $0 mail order benefit through St. John Pharmacy. You can receive a 100-day supply of Tier 1 preferred generic drugs delivered straight to your door at no cost to you. St. John's Pharmacy staff can help you transfer prescriptions and coordinate medication deliveries. Vantage members can also access their medical and pharmacy claims, authorization, and account information 24/7 through our secure member portal. All plan documents are posted there for you as well. We appreciate your time. Thank you for watching this video. If you have additional questions about Vantage's Medical Home HMO plan, we would love to help. Our member services team is available from 8 a.m. to 6 p.m. Monday through Friday. You can also email any general questions to memberservices@vhpla.com. We look forward to serving you.
We encourage you to make sure you seek treatment by a doctor or hospital that is in your provider network. You will avoid the possibility of your provider billing you for amounts in addition to your applicable copayments, coinsurance, deductibles, and non-covered services. This is often referred to as balance billing. Now let's talk about how you can enroll or make changes to your OGB health plan during annual enrollment. OGB encourages members to use the online annual enrollment portal. However, if members are discontinuing their OGB coverage, adding or removing dependents, are newly eligible employees, or are new hires, they must visit their HR department to enroll. Eligible LaGov paid employees wishing to change, waive, or enroll in a health or life insurance plan and enroll in the FSA or FSA for 2021 will do so through Louisiana Employees Online, also known as LEO. You simply log into LEO, select the My Benefits tab, and then select Annual Enrollment. For the 2021 plan year, employees will be able to make changes to their mailing address and add a personal email address. This is optional. Prior to making annual enrollment selections, both the mailing address and the personal email address will be provided to the Office of Group Benefits. To enroll, you will choose the tab of the benefit you wish to enroll in or change for 2021. Your current plan or last selection will be displayed at the top. Your new plan, your options will be displayed in the middle. Click Save to complete your selections for each enrollment. Validating your health plan selection will display the new health plan. This does not create a new selection. If you wish to remain in the same health and/or life plans with the same dependents in 2021, no action is required. To cancel your health insurance, add the HSA plan, or make any change to covered dependents, you must see HR to complete the appropriate documents. All life and dependent life plan changes must be processed by HR. The current plan and covered dependents are displayed on the Life tab. FSA and/or HSA must be re-enrolled each year. Should you decide to waive or decline coverage for 2021, a waiver form is presented for your completion. Choosing plan confirmation will display a summary of your 2021 elections. Printing this document is recommended. You can see the Annual Enrollment Quick Reference Help Guide for detailed step-by-step instructions, or contact your Human Resource Office for assistance. For our non-LaGov paid employees, you can use the OGB online enrollment portal. You can access the OGB Annual Enrollment website by following the link on the OGB homepage. Once you have reached the Annual Enrollment website, you will see Enroll Now on the right-hand side of your screen. You will select the non-LeGov employees and all paid retirees option. To log in to the portal, you will do so by entering your last name, your date of birth, the last 4 digits of your Social Security number, and your zip code. Then press the blue Submit button. This will bring you to the contact information screen. It is very important that you review this information and make sure it is all correct. If there is an error, you can make that correction here, then press the blue Confirm Address button. Next, you will make your health plan selection. Your current health plan will be selected. To make a change, click on the circle next to the plan you wish to change to, then press the blue button at the bottom of the page. If you are selecting the Pelican HSA 775 plan, you will need to enter your deduction amounts on this screen. Once complete, press the Select and Continue button. If you are renewing or enrolling in the flexible spending arrangement, you will enter your election amounts on this screen. Once complete, press the Select and Continue button. You will be given the opportunity to review your information and your selection. If everything looks correct, press the blue Confirm button. If you need to make a change, push the red Change button. Once you hit the Confirm button, a confirmation will be displayed. We highly encourage you to print and save a copy for your records. Membership in an OGB health plan comes with some added benefits. OGB cares about the health and well-being of our members, and that is why we offer several wellness and disease management programs to our members. Those programs are Access Today Health, In-Health Care and Disease Management, Live Better Louisiana, Blue Care, Amada Diabetes Prevention, and Quitters Circle Smoking Cessation. Let's learn a little more about Access Today Health.
Access to quick and affordable healthcare should be easy to find. And now, Better Health is just around the corner. The state of Louisiana and the Office of Group Benefits have partnered with Access Today Health to provide all state employees, their families, and state retirees covered under the Pelican HRA 1000, Magnolia Local Plus, and Magnolia Open Access Health plans with a special VIP clinic membership health benefit at no cost to you. This state-funded benefit gives you access to full primary, preventative, and wellness care with no copay, no deductibles, no out-of-pocket costs, no appointment needed, no insurance hassles, and a short wait time. Access to quality care is quick and simple. Finding your nearest Access Today Health clinic is easy. Just download our Clinic Finder app, visit accesstodayhealth.com, or simply call 800-797-9503 for clinic locations. When you need medical care, visit an Access Today Health clinic near you and receive treatment with no appointment necessary. Simply identify yourself as an Access Today Health member when you arrive. Now that you know how it works, let's look at an example. Meet Jane. Jane is a public school teacher on a budget with limited time. She wakes up not feeling well on a school day. Like any busy teacher, Jane can't leave school for several hours to go to the doctor. Thankfully, a nearby Access Today Health clinic is open, and she doesn't need an appointment. As an Access Today Health member, Jane is given the first available treatment room, receives her care, and is back in school in time for her students' big test. With over 50,000 visits this year, Access Today Health is a favorite benefit of our state employees and retirees.
I love knowing we have this awesome benefit. I can also take my children and know they will be treated well and I don't have to pay any out-of-pocket expense.
The care from the clinic was wonderful for my allergies. I didn't even need an appointment and there was no copay. Plus, I was in and out in about 45 minutes.
I was hesitant and a little scared to go to the clinic during the COVID-19 outbreak, but after feeling unwell and concerned, I called my nearby clinic and they assured me they were following all the CDC safety guidelines The medical staff was wonderful, and I feel so much better.
Your Special Access Today Health membership allows you to get the care you need when you need it. And remember, you are automatically enrolled in the Access Today program as a state employee or retiree if you're on one of these 4 plans. Call us at 800-797-9503, visit our website at accesstodayhealth.com, or download the Access Today app in your app store to find the clinic closest to you.
Live Better Louisiana is OGB's game plan for better health. Members who participate in the Live Better Louisiana program have the opportunity to save $120 annually on their health plan premiums simply by having their annual wellness exam. This can be achieved one of 2 ways. You can attend a Catapult Health clinic or have your primary care physician fill out the Catapult Health form found on the OGB website. The campaign for the 2022 discount will run from October 1st, 2020 through August 31st, 2021. You can find a location near you by visiting www.timeconfirm.com/OGB, or you can call 877-841-3058 to schedule an appointment. Now let's learn a little more about what you can expect when you attend a Catapult Health clinic.
Meet Jack. Like most of his friends and coworkers, Jack hates going to the doctor. The time spent waiting, the stacks of paperwork, the hassle. So most years, Jack just doesn't go. But he's in luck this year because his employer has Catapult Health. You see, here at Catapult Health, we bring the doctor's office to you. All Jack does on the day of his appointment is arrive to work a little early. Nurse Lisa from Catapult is ready when he arrives and right on time. Instead of pulling vial after vial of blood to test, Lisa performs a simple stick of Jack's finger. You see, Jack? That didn't hurt at all. Next, Nurse Lisa measures Jack's blood pressure and his belly. Then she hands over a clipboard full of paperwork for him to complete. Just kidding, Jack. That's old school. Jack completes his medical history on a touchscreen tablet, and when he finishes, his blood test results are ready, and it's time to meet with the nurse practitioner. Jack spends the next 10 minutes talking over live video with Amanda about his family health history, his blood test results, and the medications he's taking. They discuss his exercise habits, his favorite ice cream, and that he's been feeling a little depressed since his daughter left for college. Amanda then tells Jack that he's pre-diabetic. Whoa, that got Jack's attention. Amanda provides Jack with an action plan and sends it straight to his smartphone. "I can do this," says Jack. "Yes, you can," says Amanda. And just like that, in 30 to 40 minutes, Jack is done and back to work.
Blue Cross Blue Shield provides several wellness and disease management programs to members enrolled in a Blue Cross health plan. Let's find out more about those programs now.
At Blue Cross and Blue Shield of Louisiana, we know you are stronger than any disease or diagnosis. If you have been diagnosed with a serious illness, a long-term health condition, or are recovering from a severe injury, we can work with you to find a care management program that is right for you, depending on your health needs and your medical history. We have nearly 200 in-house clinical professionals, including nurses, dietitians, and social workers. We call them health coaches. Health coaches offer personalized support, information, and encouragement for your specific health needs. Our health coaches will offer tips to stick to the treatment plan your doctor made for you, share information about your health condition, work with you on areas where you want to make changes, such as quitting smoking, exercising, eating healthily, or getting preventive care. Work with you and your doctor's office to coordinate care to make it easier for you to find in-network providers for services you need. Send you preventive and wellness care reminders, sometimes along with your doctor's office. Our health coaches can help if you have chronic diseases like asthma, heart disease, or diabetes, rare conditions, high-risk pregnancy, organ or tissue transplant, serious injuries, cancer, obesity, depression, and more. We have other care management programs available to OGB members as well. OGB members who are pre-diabetic may be eligible for OMADA, a 16-week diabetes prevention plan. This digital care program uses proven behavioral science and rich data science to help members lose weight and make healthier choices. OGB members diagnosed with diabetes may be eligible for a glucometer and test strips from Abbott Diabetes Care at no out-of-pocket cost to help manage their diabetes. All OGB members can take advantage of Blue 365 Premier Health and Wellness discounts. Save on a healthier lifestyle with deals on gym memberships, healthy eating options, financial health, and more. Let's take this journey together.
Our final wellness offering is Quitter's Circle Smoking Cessation. This is a free program through Pfizer. Quitter's Circle includes a website, social media channels, and a mobile app that work together to help you kick the habit. Highlights include a personalized quit plan allowing you to quit on your terms. You can also create a quit team that allows you to invite family and friends to follow your journey and provide you encouragement along the way. The app includes links to more than 150 articles that offer inspiration and information about quitting smoking. Again, this is a free program to all members and their eligible dependents. You can learn more about Quitter's Circle by visiting their website at www.quitterscircle.com. OGB also offers term life insurance to its members. The Basic Life and Basic Plus Supplemental Plan are term life insurance plans. These plans do not build equity like a whole life insurance plan would. Under the Basic Life plan, there are two options. Under both options, the employee will have $5,000 coverage. Under option 1, the spouse has $1,000 coverage and each child has $500 coverage. Under option 2, the spouse will have $2,000 coverage and each child will have $1,000 coverage. Under the Basic Plus Supplemental Plan, there are again two options. Under both options, the employee will have up to $50,000 coverage. This amount is based on the employee's annual salary. Under option 1, the spouse will have $2,000 coverage and each child will have $1,000 coverage. Under option 2, the spouse will have $4,000 coverage and each child will have $2,000 coverage. Here are some important notes to keep in mind regarding the life insurance plans offered by OGB. Once enrolled in the life insurance, you do not have to enroll every year. Your coverage elections will be continued each year until you make a change or turn 65. Members enrolled in life insurance coverage will automatically have a 25% reduction in coverage on January 1st following their 65th birthday. Another automatic 25% reduction in coverage will take effect on January 1st following their 70th birthday. Premium rates will be reduced accordingly at this time. Newly hired employees who enroll within 30 days of employment are eligible for life insurance without providing evidence of insurability. However, existing active employees may only apply for life insurance during OGB's annual enrollment, and they may be required to present evidence of insurability to the insurer. Members currently enrolled who wish to add dependent life coverage for a spouse can do so by providing evidence of insurability. Eligible dependent children can be added without providing evidence of insurability to the insurer. Please remember that members pay 50% of their life premium and 100% of the dependent life premium. Our final benefit offering for active employees is our flexible benefits plan. So what are flexible benefits? Flexible benefits are tax-saving benefits that enable employees to save both state and federal income taxes on eligible payroll deductions for health care and dependent care. Employees of agencies that participate in the OGB-administered Flexible Benefits Plan will automatically be enrolled in the premium conversion option for all OGB products and eligible miscellaneous products. Once enrolled in the premium conversion option, enrollment will automatically continue from year to year unless the employee chooses to end participation in all coverage during the annual enrollment period or due to experiencing an OGB plan recognized qualified life event. See the Flex Plan document for additional information. Now let's take a look at the flexible spending arrangement provided by Discovery Benefits.
Hello and welcome. Thank you for joining us today to cover your company's sponsored flexible spending accounts. This presentation is being presented by Discovery Benefits. Today we're going to start by covering the Medical Flexible Spending Account. The Medical Flexible Spending Account is commonly known as an FSA. You can use your FSA for medical, dental, and vision expenses, as these are qualified under the 213 IRS rule. You can elect up to $2,750 for your medical FSA for the plan year. FSAs are a use it or lose it plan, which means that if you don't use all of the money you elected, you will forfeit the remaining dollars back to the plan. We recommend that you review your annual medical expenses to estimate how much you should elect. Discovery Benefits also has an FSA calculator that you can use to help. For a list of all eligible expenses, you can find these at our website at www.discoverybenefits.com. Click on Employees and then select Eligible Expenses. Next, let's talk about the Limited Flexible Spending Account. The Limited Flexible Spending Account can be used to cover dental, vision, and preventative care expenses. This can easily be paired with a health savings account. You can also be enrolled in the Dependent Care FSA and the Limited FSA at the same time. If you are enrolled in an HSA, you can supplement your HSA and reserve your HSA for only larger medical expenses by enrolling in a Limited Flexible Spending Account. Let's review a real-life example of how having an FSA can save you money. Meet Ashley. Ashley is a 33-year-old college graduate working in marketing. She is enrolled in an FSA and makes an annual contribution of $2,600. Because her FSA contributions are taken out pre-tax, her actual taxable income is lowered, which means she has more take-home pay than if she didn't have an FSA. For Ashley, this means an additional $468 that she gets to keep and take home. If you're enrolled in the FSA today, your plan year runs from January 1st through December 31st. Your company does offer a grace period, which means you have until March 15th to incur expenses. April 30th is your runout date, which means you have until April 30th to submit any remaining claims that you incurred during the plan year and grace period. If your claims are not received by this date, you will forfeit your remaining dollars back to the plan. If you are submitting a claim via your mobile app, your online account, or manually through the mail, the best form of receipt or documentation is an explanation of benefits, as it contains all of the necessary information for Discovery Benefits to approve your claim. You'll receive your explanation of benefits or EOB from your medical, dental, or vision carriers. Now let's talk about the Dependent Care Flexible Spending Account. Your Dependent Care FSA can be used to pay for out-of-pocket daycare expenses, after-school programs, and day camp programs for dependents up to the age of 13. It also covers a cost for a disabled spouse or dependent of any age. Your household can elect up to $5,000 annually through the Dependent Care FSA. A household can be a single adult electing, or if you are married or have a domestic partner, and elect $5,000 total together as a household. If you are married but filing separately, your total annual election can still not exceed $5,000. We do offer a recurring dependent care request form that makes utilizing your dependent care dollars really easy. Simply fill the form out once, submit it to Discovery Benefits, and if approved, we will reimburse you every time that you contribute to your dependent care account. Let's review a real-life example of how having a dependent care FSA can save you money. Meet Kenneth. Kenneth is a 36-year-old single father with 2 children in daycare. He is enrolled in the Dependent Care FSA and makes an annual contribution of $5,000. Because his Dependent Care FSA contributions are taken out pre-tax, his actual taxable income is lowered, which means he has more take-home pay than if he didn't have the Dependent Care FSA. For Kenneth, this means an additional $900 that he gets to keep and take home. If you're enrolled in the Dependent Care Plan, your plan year runs from January 1st through December 31st. You do have a grace period, which means you have until March 15th to incur expenses for reimbursement. April 30th is your runout date, which means you have until April 30th to submit any remaining claims that you incurred during the plan year and grace period. If your claims are not received by this date, you will forfeit your remaining dollars back to the plan. Once you elect a medical FSA or a dependent care FSA, you cannot change your election unless you have a qualifying event. A qualifying event includes change in marital status, number of dependents, or a job status change. For the dependent care FSA, another qualifying event includes any changes in daycare cost or a provider change. You have 30 days from the date of your qualifying event to notify your employer to make any election changes. These qualifying events may change due to COVID. If you have any further questions, please speak with your human resources. Your enrollment in a flexible spending account does include our free benefits debit card. This allows you to easily access your FSA funds right from your wallet to help you minimize the amount of out-of-pocket spending. If you already have our Discovery Benefits debit card, they are good for 3 years, so if you received one within the last 2 years, you will not get a new one again next year. We will mail you a new debit card 90 days before the expiration date of your current debit card. All new cards will be good for 4 years. Regardless if you are enrolled in the Medical FSA, Limited FSA, or Dependent Care FSA, you will use the same debit card. If your card is lost or stolen, you can order a new card free of charge from the Benefits mobile app or by going through your online account. You can request a Discovery Benefits debit card for your dependents and/or spouse. Please note, a dependent must be 18 years of age or older to receive a Benefits debit card. The Discovery Benefits debit card is the most common way to file claims against your FSA. You can also submit a claim by using your mobile app. Simply log in, select File a Claim, and use the easy-to-follow steps. You can even take a picture of your explanation of benefits or itemized receipt right from your mobile phone. And of course, you can submit a claim through your online account by following similar steps and uploading documentation, or by submitting the out-of-pocket reimbursement request form. All claims are processed within 2 business days, and you can choose to be reimbursed through direct deposit right to your bank account or have a check mailed to you. Direct deposit is provided free of charge and is a quick and easy way to get your reimbursement. If you are ever in any need of additional information, you can find a bunch of great resources right from our website, including that eligible expenses list we mentioned earlier. From the top menu bar, you'll select Employees, and you'll also see a link to our expense list or our resource center that has a variety of videos and handouts that can help you. We want to take just a moment to highlight for you how you can access your account. You can get access to information about your account by logging into your online account, downloading the Discovery Benefits mobile app, or by calling our Participant Services Department. Your consumer online account provides you with everything that you'll need to manage your FSA. You can view account balances, submit claims or documentation, set up direct deposit, and order debit cards. Or you can select Get Help from the I Want To widget, and this gives you access to hundreds of helpful articles and the ability to contact an agent directly through chat. The Discovery Benefits mobile app provides you with quick and easy access to your online account. After logging in for the first time, You can set up a fingerprint access right from your phone. Let's say that you're enrolled in the FSA and you're getting to the end of your plan year and you still have FSA funds that you need to use. This is a use it or lose it plan, so you'll need to spend those funds before the end of your runout period. One great way to spend your FSA funds is by using the FSA store. We do have a link to the FSA store right from your online account. Go to Contact Us at the top of the screen, then scroll down and you'll find Shop for Eligible FSA Expenses or Shop for Eligible HSA Expenses. Our participant services team is available to you Monday through Friday from 6 a.m. to 9 p.m. Central Standard Time. You have a variety of options when contacting us. You can use the chat feature from our website by logging into your online account. You can email us or you can call us and check your balance using the automated system. Lastly, I just want to thank you so much for taking the time to learn about your benefits. And if you have any questions, please do not hesitate to reach out to us and we would be happy to help. Thank you.
If you have questions about your coverage and benefits, you can reach out to our vendors or you can reach out to OGB. This is the contact information for our health plan providers. If you have questions about your benefits or coverage, reach out to the appropriate vendor at the phone number or website listed. You can also reach out to OGB with questions. There is a wealth of information available to our members on our website, info.groupbenefits.org, or on the annual enrollment website at annualenrollment.groupbenefits.org. Our customer service department is open Monday through Friday, 8 a.m. to 4:30 p.m. That number is 800-272-8451. Please note that due to COVID-19, walk-in appointments at our office in the Claiborne building are by appointment only. Thank you for watching this presentation. Remember, you can get more information about annual enrollment by visiting OGB's annual enrollment website at annualenrollment.groupbenefits.org.